I graduated believing that mercury and amalgam fillings were safe. If I can preserve what's natural, why am I going to remove a tooth that can be treated and put an implant instead? Is fluoride actually the best thing to prevent decay? I'm Dr.Maria Florou, and this is Mind Your Mouth. I'll be sharing with you the truth about oral health that most people completely overlook. If you're ready to go beyond the basics, challenge the myths, and truly transform your well-being, let's get started. On this episode, we're going to talk about the controversies in dentistry. So all the things that I hear and talk about with people that come across our practice and also my friends and family. And let's dive into these topics a little bit more here. The first one, fluoride. I'm not going to get tired of talking about fluoride in this podcast, in these videos, because it's a big topic. We want to understand fluoride a little bit better. When we look at the research about fluoride, yes, fluoride has a place in dentistry. But is it the best thing that we can have on our toothpaste and our mouthwashes? Is fluoride actually the best thing to prevent decay? No. We know nowadays that we have a lot of other things that we can use to favor our oral health, but our general health as well. Fluoride, depending on the quantity, depending on how often you have it, how much you drink fluoridated water and things like that, we know that there is an effect that's not a desirable effect in the body. We know that there have been a lot of studies showing the influence of fluoride in the endocrine system and other systems and functions of the body. So if we can avoid it, yes, we should avoid it. But we should make sure that we're looking after our health and our teeth in a more comprehensive way. So what does that mean? That we should look after what we're eating, what we're drinking, how often we're doing that, how often we're brushing, flossing, and we're not just relying on the toothpaste and the mouthwash alone for our oral health. If we make sure that we're following all the other steps, no, fluoride is no longer needed for especially adult teeth. We don't want fluoride. And when it comes to young children, we also don't want to give fluoride to them if we're making sure we're looking after all other things. I'll just make a quick note here about fluoride and kids, because it's one thing that I see a lot in the practice. A lot of families come to me and say, Maria, we don't use fluoride and we have a very healthy diet. What does that mean? The kids take to school dried fruits and other things that are very chewy and they have hidden sugars in them, and they come back to us with cavities. So we want to make sure we're looking at what we're putting in our mouth from all aspects, not just the dental products that we use. The other controversial topic that we hear a lot is the one about root canal therapies, root canal treatments. What does a root canal mean for those who don't understand what a root canal is? Root canal is when we have the bacteria, or there's been a trauma on the tooth and the nerve that lies inside the tooth is dead. So either due to infection or due to trauma. Now, what we need to do about that? So we have to discuss the options with our patients. But if we want to preserve the tooth, yes, a root canal treatment is needed. And I know how controversial that is, listening that from me. So what I wanted to understand is that in my mind, and that's how I practice with my patients and with my family, if I can preserve what's natural, why am I going to remove a tooth that can be treated and put an implant instead? Is the implant better than the root canal treated tooth? I'll leave that answer for you. Real quick, your mouth is the gateway to your overall health. And at Casuarina Dental, our focus is on you. If you're ready for a holistic approach to dental care, book your appointment now via the link in the show notes. Now, back to the episode. In my opinion, I'm very conservative. I would prefer having the root canal. And in fact, I do have a root canal in my mouth. And that's what I preach. That's what I believe in. I see the research. If the root canal treatment is well done, there's no infection there. And nowadays we have ways of checking that. We have tomographies. We have other computerized imaging that we can use to detect if there is a silent infection. When I see silent infections, though, then it's when the question arises and I talk to my patient. What are we going to do about that infection? What are we going to do about that root canal treated tooth that's already infected? And then it's when we may consider other options. But my first answer to you would be, if a root canal treatment is well done and there's no infection, and sometimes it's not just about the way that's done, but if there's no secondary infection, we keep the root canal there. The third topic that I want to talk to you, and that's very controversial. Now, depending on your age, you don't know what I'm talking about, but talk to your mom, talk to your dad, talk to the older people that you love. They might have one of these feelings. And I'm talking about a silver filling here, also known as amalgam filling. What is an amalgam filling? To make this short, I'm going to say it's a metal filling, usually placed on back teeth. That metal is comprised of a mixture of, that alloy, I should say, it's a mixture of metals. And some of these metals are copper, tin, and especially mercury. Mercury comprises of more than 50, yes, you heard me correctly, more than 50% of those fillings are made out of mercury. What happens with that mercury? When I graduated, I left uni back in the day, I'm not going to say when, just joking, in 2000, I graduated believing that mercury and amalgam fillings were safe. We just place them, we're happy, people are able to chew, there's no pain, everything is fine. But in fact, what we've seen through research, and we see several studies on it nowadays, every time that there's heat around the amalgam filling, mercury leaks from the fillings in a vapor form. So most people won't feel the taste of it, there won't be any direct consequences from it, but mercury is been intoxicating your body. People deal with it in different ways. Some people can eliminate parts of the mercury easily. Look, that's a whole big topic on amalgam fillings and mercury, but what I want to say to you, yes, they do release mercury. Talk to a health professional, check your heavy metal toxicity levels. Let's have a look into that. And when it comes to replacing those fillings, they cannot be removed just like a normal other filling would be removed. You need to have certain precautions in place when removing and dealing with fillings with mercury. So know that, do your research, make an educated decision. And if you're not the one who has those fillings in your mouth, send this video to someone who you love that might have one of those fillings in the mouth. We don't want heavy metal toxicity in our body that influences our nervous system. It's a whole cascade of effects that we can see from that. Now, how are we going to replace those fillings? Are all white fillings the same? No, not all white fillings are the same. And there is a big topic about this now, but we know that the safest fillings are the ceramic-based fillings. So when we look at ceramic, it's like a glass. It doesn't leak any other bad components or harmful components to the body. So ceramic fillings are the way to go. And what that means, it means that they mimic the enamel better with no side effects. One downside of the amalgam filling and metal filling is that any metal expands and contracts a lot more than the actual enamel can do, until the point where eventually we see fractures on teeth. The white fillings do not behave the same way. They're a lot more stable, but look for ceramic fillings and not just any white filling. I hope this information was useful to you. Share this with the people that you love. Let's work together for better health. See you on the next episode. Thank you for tuning into Mind Your Mouth. These episodes have been created for you. If you found this conversation helpful, the best way to support the show is by leaving a 5-star review on Apple Podcasts and Spotify. And don't forget to subscribe on YouTube so you never miss an episode. For more tips on holistic dental health, follow me on social media at Casuarina Dental. In the meantime, take care of your smile, take care of your health, and I'll see you in the next episode.